showed up with Carly, who was at the time, she was 6 months old. And I'm sure I was going to Dr. Jackas for chiropractic.
And this is Carly.
This is Carly.
And there's she's 10.
Right. And so we started coming to Dr. Timmy for our chiropractic. And Carly was 6 months, and then Katie was 5 days old. After we got out of the hospital, all through her pregnancy and stuff, and you know, it was one of the things Tammy recommended was after she's born, get her in here. And we believed in it, and right after we got out of the hospital, she was here.
Teach all my patients about the birth process and how traumatic it can be, and it is one of the most traumatic things we'll ever go through in our lifetime. So they got it. They understood that concept, and they brought their kids in.
It should have been earlier. Really.
But my big fear was getting pregnant, and how would I deal with a bad back when I'm pregnant? You know, how am I going to cope if I can't cope without the pregnancy? But it has actually really helped me, like tremendously. I think I have occasional bouts of pain, but that's due to, you know, the size and so on. But other than that, it's been phenomenal.
So this is your first child?
This is my first child.
And no apprehension, and no apprehensions about 2.5 weeks before you're due to come in to a chiropractor?
No, I've been coming in regularly throughout my pregnancy. I'm not nervous at all about that.
One of the things I like to do, especially towards the end of their pregnancy, is work with different parts of the spine that help to calm the nervous system. So that would be called the parasympathetic part of the nervous system. And that's really important for labor and delivery, to make sure that system is working at its best. Women that are too stressed out, they have a harder time delivering. So one of the things that we really try to do is just calm the nervous system. The adjustments are certainly more gentle for pregnant women as well. And we're always looking to make sure the pelvis is in the proper position. If it's not, one of the things that chiropractic can do is help to realign the pelvis and rebalance some of the muscles and ligaments so that the baby has the best chance of a great delivery. If the baby were breached, there's a certain technique called the Webster technique that we're certified in, which again just helps to balance the muscles and ligaments. And many times in our office, at least 95% of the time, the baby was able to turn, and then the woman was able to have a vaginal delivery versus a C-section. So, very important.
Sure. When I was about 7.5 months pregnant, I was in a pretty bad car accident where the car was totaled, so I had concerns there. And then she was 3 weeks early, and she delivered breech vaginally. So I was concerned about hip displacement, and that's why we started bringing her in.
Your hips feel good.
So all the regular visits.
Well, you do have a slight subluxation in here, but it's, you know, you're doing well. And even here, it's just slight. This is a technique too called Logan that also just helps to balance that part of the nervous system, the parasympathetics. It just calms the whole person. I can even see you're breathing deeper with this adjustment.
Yeah, I've been thinking about that a lot. I know I've seen a lot of children, a lot of babies come into the office, and I hadn't given it much thought until recently. And now I see the value in that. I think I would totally do that. Yeah, whether I'm one of those people that, you know, has an adjustment on the day of birth, I don't think so. I don't know if I've warmed up to the idea that much. That's just, you know, me. But yeah, I would definitely bring my child here.
All right, you are done. Ready? Ready? Woohoo!